Ladies and gentlemen, Assalamu alaikum wa rahmatullahi wa barakatuh. Good afternoon to you all, and thank you for joining us today. Every year during WEB, University Development organizes a lecture series featuring prominent business leaders and professionals from the kingdom. These individuals have been instrumental in shaping the business outlook within the kingdom and beyond. Our guest speaker today is Engineer Yasser Joharji, CEO of Nahdi Medical Company. Engineer Joharji has extensive experience spanning more than 20 years in the field of marketing. He joined Nahdi Medical Company in September 2014 as the CEO. Before joining the Nahdi Medical Company, Engineer Joharji has spent 20 years at Unilever, one of the largest multinational companies in the world. He held several important positions until he left the company as a general manager in 2014. Before that, he served as a senior brand manager at Safola, one of the largest food companies in the Middle East. In addition to his eclectic career, Engineer Joharji is also an advocate of public affairs. He is an active member of Khadija bint Khuwailid Center, a group that supports women interests and issues. Engineer Joharji is also a member of a knowledge group that supports family guidance. Engineer Joharji holds a bachelor's degree in industrial engineering from King Saud University. We are delighted to have Engineer Joharji with us today for his speech on using your business to add beats to people's life. Please help me in welcoming Engineer Yasser Joharji.
Bismillah, wassalatu wassalam ala Rasulillah, Sayyidina Muhammad wa ala alihi wa sahbihi ajma'in. Ladies and gentlemen, thank you very much for having me here today, and thank you for coming to this, hopefully, not a very long speech, or I would like to call it a discussion. I really don't know how much value I can add to you after what I've seen during the tour this morning with Engineer Hani. Fortunately, we have big educational organizations like this in our country. So impressive, that makes me and all of us so proud of the high quality standards we have seen in just a glance view of what you have in this organization. Congratulations for all of you for being part of this amazing educational castle in Saudi Arabia. And I wish all of you the best in your education and your researches. I was really trying to figure out what value I can add to this amazing, highly intellectual group of talent. And there is one thing that I have learned throughout my career and my life, which I would like to share with you, but in a business structured manner. How to use your business or your education or your research or your interest in science or any other thing you are doing in life, whether you are a taxi driver or a scientist or a CEO of a business, to add beats to life. And when we talk about beats, we talk about purpose. I really want you to think throughout this presentation, not about what I'm going to say, but I want each one of you to think about what he or she is doing. Lucky enough, unlike what Hani told me 10 minutes ago, and the 1,000 years ago, the day consists of 16 hours. Now we're talking about 24 hours a day. So you have amazing resource of time, and you have your amazing resource of talent, which was given to us by Allah subhanahu wa ta'ala. And especially you, as a group in this room, you have the gift of high intellectual capacity, which differentiates you from many other people around the world. How are we going to put those resources to add to the life we are going through day by day and hour by hour? In our business, when I joined a couple of years ago, Nahdi was a very, very, very successful pharmacy chain. People who come from around the world, I can assure you that if you visit one of our stores, you will go through a similar experience to what you have in Boots or Walgreens or CVS or Watson's or many other global pharmacy chains around the world. Even better in certain places. We spend a lot of time and energy trying to be the best of who we are and provide the best to our guests who visit us every day and every year. But we figured that our contribution to the society can be bigger and better. And we can add to every guest who engage with us in our stores and move that from a transaction where they give us money and we probably give them medicines into a beat which adds life to their lives. What have we done? We looked at our capabilities. We looked at the environment that, and the community we are working and operating in. And we found the following. We found an aging population. One of our key highlights of 2030 vision is a clear target of increasing number of years of life expectancy of Saudi population. But guess what? If you want to increase your average life expectancy, I assure you, you don't want to spend the last few years of your life going through pain of chronic diseases or the consequences of those chronic diseases. And the question was, how can we add value to that? If we look at the community around us, we asked ourselves some fundamental questions. This country and this region, and I guess the world, is facing massive issue with chronic diseases. Diabetes is one of the biggest challenges for the healthcare system around the world, and especially in Saudi Arabia. I think there are different numbers. This is the official numbers that I'm using here, but I assure you some people think it might be 25 or even more % of the population live with diabetes. And people who live with diabetes can eventually run the risk of kidney failure, heart diseases, and severe measures like amputation, God forbids. Immunization is another issue which we have faced recently in the last 5 years with things that expose the entire population, especially that we have an open gate for religious tourism, which makes us very vulnerable for diseases that can come from overseas. Another important cause of community health problems is obesity. You know, who remembers that game on TV when you do it's called Wii from Nintendo? When you put your numbers and that voiceover comes out and says, you're obese. At the beginning you are at denial, then you realize that most of us are with different levels, but obesity is one of the key challenges facing the population in Saudi Arabia and around the world. So it's a global phenomenon that leads to other serious healthcare problems. Last but not least, are we teaching our children and instilling in them the right healthy habits that will enable them to have better future? Are we really paying attention to what are we feeding them, to the nutritional values, to building good, simple, everyday healthy habits in them? And the answer is probably not satisfactory. So we ask ourselves those questions, and that coincided with the launch of Saudi Arabia's 2030 vision, and we found a lot of great common ground between what we do and what came in that vision. Not the least of them is the clear, big objective in the vision, which says we want to have healthy and vitality population. So what is our role in the pharmacy? So we went back to the drawing board. And I would like here to give big credit to Dr. Sara Turkestani, who is the lead of our corporate social sustainability program, for her passion and dedication and comprehensive work to come up with what we are going to do to add value and add beats to people's life in a very methodical manner. But we asked ourselves, what is the role that we can play? So we went around the world. We asked people who have been there and done that. We did a research, which probably you do every day. We talked to people from CVS, Walgreens, Watsons, all the big companies around the world. And we found out that pharmacy, usually, is the first line of healthcare defense in any country. So if you really want to have a fully integrated and operational healthcare system, it starts by enabling your first line of defense, which is pharmacy, to contribute to the greater good and the well-being of the society. Because we are in every community. In Nahdi, we feel so proud, ladies and gentlemen, that we are at 5 minutes away from 90% of the population. We are 5 minutes away. Just imagine, you open the door of your house, you drive for 5 minutes, and you are in one of our stores. And the question could be, not here. Well, you are from the 10% that is not yet within reach. Hopefully, we will do something about that. So we are available in 130 cities and small towns in Saudi Arabia. We are visited by tens of millions of people. We are trusted by our customers. So we can influence the everyday habits of the people we serve. What did we do? We looked at what we can offer. When you get a customer or a guest in a rural area like Jizan or Dair or Tual or Adam, those are cities, by the way, in Saudi Arabia, which you have never heard about. And that person needs an oncology medication. And at that point of time, no one can deliver it to them. We do. So we can add value by improving accessibility of people in need to medications. We can help people who are in chronic diseases to get their medications on time, to adhere to their medications, and improve their biometrics. We can add value by spreading the seasonal vaccines everywhere in the country and minimize the risks of diseases in Saudi Arabia. We can add value by educating people about what is a healthy lifestyle. So basically, we found the brilliant spot which builds on our capability and the gap in the healthcare system in the society. So we decided that this is where we want to play. We want to be the lever that enables people to live healthy lifestyle. So what did we say? In the past, we used to get different ad hoc requests. Today, we are managing by strategy. And we said simply the contribution we will have in the society, the beats we will add to the society, come under three key pillars: yesterday, today, and tomorrow. Yesterday is all about people who already have chronic diseases. How can we help them still with a chronic disease to live a healthy lifestyle? Today is you. How can we help you and encourage you to live a healthy lifestyle? Have healthy food, walk, exercise. And the future are all the children. Do you know that in Saudi Arabia, every minute there is a new baby born? And those children need to be educated well. They need parents who have good knowledge about how to raise their children in healthy conditions. So we decided that we will go after this under the big umbrella of what we call a Nahdi hope. What have we done? It's very easy for me to stand in front of you here and talk about strategies and big things which most of business leaders do. But we decided that we will talk and we will walk the talk. So what have we done? Under each one of those pillars, we already have great examples. And we linked everything to the bigger picture, which was announced by the United Nations under the 17 Sustainable Development Goals. And number 3 was to provide communities with good health and well-being. So we come and we link ourselves to that greater good under the global umbrella. And by the way, that's not only because we want to feel good and proud about that, because we want to take learning from global experiences. And we build the ecosystem that will enable us to contribute to the community. And what is that ecosystem? We have 3,000 pharmacists where we spent last year 75,000 hours of training them on how to contribute positively to the health and well-being of our guests. As simple as that. We are leveraging our experience. We are providing our guests with the best ambience for shopping experiences that enables them. Pharmacy today is not anymore a place where you want to walk in to buy a medication and walk out. It's a place where you want to go in and enjoy a shopping experience. I am sure if you visit one of our pharmacies, you will go through that experience, and that will encourage you to buy products that and invest in your health and well-being with product and solutions that makes you live a better, healthy lifestyle. So we decided that we want to bridge the knowledge gap that people have when it comes to health and well-being. A very simple example, you tell me, Yasser, what does that mean? In one of our 50 diabetic education centers around Saudi Arabia, one chronic disease guy who has diabetic walked in and he told the pharmacist, I take my insulin injection every day, but nothing happens. I still get very high readings. What we figured out that this guy is taking his insulin shot in the same place every day, which created a very thick skin and the medication does not penetrate. A very simple knowledge gap. Someone missed to tell him, you have to take it every day in a different place. As simple as that. And this is what we believe in, ladies and gentlemen. Small actions and small information that can really make a big difference in people's life. And for us, each of our guests, is a VIP and very important life. This is the corner that I talked to you about. We have developed this over the last 4 years with Joslin Center, which is associated with Harvard Medical School, and with the Ministry of Health. And we have done intensive experimentation and research and pilots before we roll out. And I just want to leave with you a couple of numbers. You're probably not as similar to me. I'm not so familiar with those biometrics, but I can tell you what I was told by my team and by the minister. We discovered that this program, or such programs, which are unique around the world, by the way. Yeah? Dr. Sarah was in the US and presented that program to the Diabetic Association and to Joslin, and we have clear indications that we are one of the few around the world who are running such programs. This can save the country 90% of the cost that they spend on chronic disease complexities and consequences. And I want to leave you on this program with a very simple number, because you are all post-education students and you believe in numbers. The A1C is the biometric measure for diabetic patients. So normal people go in A1C below 5, below 6, if I'm not wrong, Dr. Sarah. Above that, a little bit, you are pre-diabetic, and above 6, you are diabetic, and some people go up to 12, which is a very high and serious cases. When we started this program, we realized that by educating people, we managed to reduce over a period of 1 year the A1C average by 1%. What does that mean? So if you're 11, you come down to 10. If you're 6, you come down to 5. 1% reduction in A1C is 20 to 40% reduction in the consequences that diabetic patients go through in their life. What do I mean specifically? Consequences like kidney failures, heart attacks, amputations. So we are not only educating them, we are helping their future life and avoiding suffering in their lives. One of the most beautiful measures that we have started to embrace with Joslin is the stress level. The stress level is a measure when you have too many things. Now, let me give you an example. You have a paper that you have to submit tomorrow. So your mind is so busy, you're under a lot of stress. And this puts massive pressure on you, which reflects on your health and well-being. The same thing happens with the diabetic patients every day, by the way. So by reducing the stress level for the diabetic patient, they live a better and healthier life. Some countries, some neighbor countries have Wazir al-Sa'ada or Wazirat al-Sa'ada. No happiness is more appreciated than a person with chronic disease, where you stabilize their conditions and you make them feel that they're normal people. They don't need to panic. So this is just an example of how purpose-driven organization you can be. Even if you want to make money. Tell me why. Because I don't make direct money from this, but those thousands of people who have gone through this experience, next time they look for a pharmacy to shop from, guess where they will go? Where do you think they will go? Exactly. And that is the point. You are increasing your engagement, your support to the community you operate and live in. And this is true partnership with our people. Other examples for healthy lifestyle. A project called WAZN. WAZN, where we encourage people to take steps in their life, to do things in their life which help them to lose weight. So we measured in 30 of our pharmacies, we measured before and after, in 1 month's time, the total number of participants. We gave them some advices, The amount of fat that was lost in 1 month was around 3 tons. Well, just imagine a room like this full of fat that was lost, which could cause many harms to those people's health and well-being in 1 month. So we can add great value. You tell me, okay, but anyone can. I can go to a gym and people, and the coach will tell me how to live a healthy lifestyle. The amount of trust people have in their pharmacists, you ask yourself, if you have grown up in a neighborhood and that pharmacy in the entry of your neighborhood, how much you trust that pharmacist who operate over there? Yeah? He is a person or a source which you take information and change habits based on their advices. We do activities that we feel so proud about. One of our most important parts of the business is our presence in Mecca and Medina, the Haram pharmacies, where we serve not the guests of a Nahdi, but we serve the guests of Allah subhanahu wa ta'ala. People who come to Mecca and Medina to perform Hajj and Umrah, they come once a lifetime. Our service to them has to be, one, best in class. And when I say best in class, I mean world class. Yeah? And they feel so proud of coming to an Islamic country, to the 2 holy mosques, and they see one of the top services in retail industry they get around the world. 2, we have to make them live healthy during those two weeks they live in Jeddah, in Mecca and Medina, because they want to spend their time. It's like when you go through exams time and you fall sick. You don't want that to happen. So we provide them with that support. We recorded the Guinness record this year by doing the biometric measures for more than 4,000 pilgrims in less than 12 hours. That was a bit of show off because we wanted to show ourselves that we're capable of making big impact and, more importantly, serving the pilgrims who come to Mecca and Medina. We feel so proud, and we have received many compliments from the Ministry of Health on this activity, and we will continue adding beats to the lives of the pilgrims who come to Mecca and Medina. We have partnerships. We go around the country. There are 159 small towns and cities in Saudi Arabia. Some of them, I assure you, they don't even have the money to buy medications. There are organizations, NGOs, who go around the country helping those people, and we join them by providing them with free medications. So we have an extended role beyond the doors of our pharmacies, ladies and gentlemen, but in an area where we are experts at. It's the medicine, the pharmaceuticals. Last but not least, we have just launched 1st of January, a new mega activity, which I would urge every one of you to download the application and take part in this activity, where we are challenging the society to take 1 billion steps in 30 days' time. Why are we doing this? I cannot come to someone who does not move and ask him to swim or to jog or to play tennis or to do heavy sport. But I can come to that person and tell them, just go walk. Park your car a little bit at distance. Take the stairs instead of the elevator. Take small steps that make big difference. We thought that we can encourage people to take 1 billion steps in 30 days. And guess what? To our surprise, we were proven wrong. People took 1 billion steps in 15 days. And now we believe that we're marching towards 2 billion by the end of January, inshallah. I would like to share with you the communication that was developed with this campaign. And Thank you.
شعب واحد رايح مشوار واحد، اللي في الغرب يقول للشرق ما بيننا فرق، واللي في الجنوب يقول للشمال حنا للوطن خير مثال، والعاصمة تردد حنا كمثل الجسد الواحد، نشاط وعمل وقلوب كلها أمل. يلا نمشي ونحقق مليار خطوة، ونخلي صحتنا ومستقبلنا أعظم ثروة، ونقول كلنا بصوت واحد بالطول بالعرض خطوتنا تهز الأرض.
All what you have seen so far, we call corporate social sustainability for a reason. Why do we call it corporate social sustainability, not corporate social responsibility? Responsibility means that we have to do it. We don't want to do it, but we have to. Sustainability means it's good for our business, it's good for the community we're serving, and it's integrated into our reason for existence. Because we believe that we will do well by doing good. We are becoming a purpose-driven organization from a financially driven organization into a purpose-driven organization. And our purpose is simply this. We want to add beats to your lives, which makes it very personal to every guest we serve. We operate 24/7, 365 days a year, and we want to add beats to every guest's life. Now, before I conclude, I just want to ask you a question. A pharmacy chain CEO stands in front of you and talks about the activities they're doing for the corporate social sustainability. What does that mean to you? It means probably nothing or close to nothing. But why am I sharing this with you today? Because I want each one of you to go back and ask yourself, why am I doing this? What is the purpose that will keep me awake, that will keep me motivated, that will keep me excited, that will make me add beats to life around me? Each one of you come to this place, spend 3 to 4 or 5 years or less or more for a good reason. Don't spend your time not knowing what is the purpose of what you're doing. And this purpose, by the way, can change with the time. Yeah? It can evolve. It gets better and improved and refined. The more you understand who you are, what you're good at, the better this purpose becomes. I believe that if each one of us become the best of what he is, what he was created to be, life will get better, our country will be better, the world will be a better place to live in. So I urge each one of you to ask those questions. What am I good at? What's my purpose in life? And how am I going to add value to life? And if what you are doing is a true enabler and contributor to that purpose, do it. If not, well, I'm not encouraging people to quit, but please do quit. Because your life is not a rehearsal. Your life is the real show. Thank you very much, and I would like to open the door for questions.
Thank you very much, Engineer Joharji, for this inspiring and great lecture, and thanks for sharing the great achievement of Nahdi Medical Company. Questions?
But look, for any business questions, I have my two VPs with me here who will take the tough ones.
Thank you, very inspiring talk. We're very lucky to have a Nahdi near us. It's only 5 minutes away in Asuwal, so we are still within that 90%. Now, I'd like to hear your thoughts on two things. One, we live in a region where doctors tend to overprescribe medicines. For example, we have a huge overprescribe medicines, for example, antibiotics. What sort of steps is Nahdi taking to protect us from that onslaught of antibiotics? This is one. And the second thing is, I just like to have a sense of how Vision 2030 has helped you. For example, things which you're doing only because 2030 opened your eyes and you're doing that to make Saudi sort of fulfill the 2030 dream.
Sorry, I missed your good name, please?
Usman.
Usman. Thank you very much, Usman, for the good questions.
Thank you.
A bit tough, but I'll do my best. With regard to the second one, let me start by the second one, Vision 2030. It coincided with what we're doing. But what it did to us, it inspired us. It helped us very much because anyone who lives in Saudi today, and we compare to 5 years ago, there is noticeable difference in the attitude of the government side. People who work in government today are very action-oriented. They're more open to new ideas. They're embracing the vision very much. And they appreciate what the private sector can contribute with to the total vision to make it happen. So it is really helping us a lot. Let me go back to the first question. 3 years ago, while in Saudi, this is the practice, not only in Saudi, I think in the entire Middle East and beyond. The practice is medicines are dispensed without prescription. We in Nahdi took a unilateral decision to classify medications in our business to 3 levels. 1 is green, 2 is orange, 3 is red. Where green, mostly OTC, which is allowed around the world to be dispensed. Orange is a place where we run a dialogue, so we question the reason, the root causes, the age, the who, the what, and the how of who's going to take those medications, and the pharmacists have the empowered not to dispense. Red, it means a red zone. You don't get a prescription, you don't get the medicine. And we have seen a lot of funny incidents where our pharmacists have been attacked by some of the guests for not dispensing, but we took a decision based on our value system and based on our values that we really want to gradually contribute to that. Now, a lot of people say, why didn't you just stop that? We cannot, because the healthcare system in the country does not have the capacity to generate this high number of prescriptions. And as I said at the beginning, pharmacists are the first line of defense. A mother with a 2 years baby who's having fever, she needs someone at midnight. We're open, we're next to her, we're 5 minutes. Most of the hospitals cannot take her at that point of time. So we are gradually trying to improve and apply values and professional systems in the industry. And by the way, before I come here this morning, Hassam, myself, with our operational team and the entire pharmaceutical teams, we were in a full discussion of what is the next step. And we have taken some few decisions which will raise the bar a little bit higher, inshallah. Thank you for the question.
Thank you. Any other question?
Thank you for the talk. I just want to know that you talked about adding beats to the life of people and so many other initiatives. Do you have any program for the used medicines for those people who cannot afford these kind of medicines? I mean, people who don't have gold insurance and they are poor. Do you have any program for those people?
Your good name is?
Shahid.
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 Thank you, Shahid, for the question. Around the world, it's not recommended by FDAs and SFDA to use or dispense used medications. But what we do to contribute to people who are underprivileged people, we contribute with medicines in the caravans that go with the NGOs around the country by giving them free medications for their diseases, for their chronic diseases. So while the regulations does not allow reusing used medications, but we try to help in a different way. Thank you.
Khalid Al-Harthi. I'm just wondering, how do you guys make money, really? Because you are everywhere.
How do we make money?
Yeah, I mean, like, you can see a Nahdi, like, just sometimes within 200 meters. What I'd like to say, I'm just trying to ask you, like, you have overtaken the small businesses, so small pharmacies. So that impact kind of led many small pharmacies to be out of the business. So, I mean, instead of contributing to develop the dispensing of drugs and all these kind of things, the expansion is sometimes unjustified. I mean, you can see like 3-4 pharmacies within just like half mile circle. So. Is there any plan to develop the business in the way that we can really track the medicine and that can benefit the society? Thank you.
Thank you, Khalid. Very good question. Where do you live? Where do you live?
Here in Kaust.
So we don't have shops here in Kaust. So how are you saying you have 3-4 in one street? You don't have any here in Kaust. I think we're yet to open one, but I understand your question. Look, it's a very good question. We started 30 years ago with one store in Hayat Jama in Jeddah with a vision of a man who's an entrepreneur who spent his day and night sitting, learning, managing that pharmacy, putting everything he has in life behind that one pharmacy, risking everything he has in life in that pharmacy, hoping that one day it will become a big organization. That man started from the zero. And if you are in Jeddah at any time, I'm willing to take you to that one pharmacy because we still keep it open in Hayat Jama in Jeddah. That man built this huge organization, and we don't feel shame about that. We feel so proud that we started with an entrepreneur 30 years ago, and we reached to where we are today. Now, let me ask you a question, and maybe Hani can help me answer this question. Do you guys in this university feel that you are the elite? Probably yes. Why? Because you work hard, you invest in yourself, you have sleepless nights, and you put efforts that many other mediocres do not put in life. That's exactly why you are here and why you are one of the few people around the world who have been accepted in this university. That's why, for the exact reason why we're so successful, because we invest in ourselves, we sharpen our soul, we make sure that we add value to the society and the community we operate in. Hence, people trust us. And when it comes to choice, they come and choose shopping from our stores and trusting our pharmacists. As simple as that. If you want to compromise in your health and buy an expired medication, Be our guest, go to the one next door. If you want a trustworthy organization that works 24/7 to provide you with the best solutions, please come to us. Now, I want to clarify one fact which a lot of people do not recognize. What do you think our market share is? Khalid? 70. Our market share in Saudi Arabia is 13%, 1-3. 13%. But when we choose our locations, we choose it carefully. When we brand our stores, we brand it well. When we serve our customers, we do everything we can to make them happy. That's what makes people like yourself believe that we are 70% market share, while in reality we are only 13. So this is when you have bigger impact than reality. Thank you very much for the question. Sorry. Well, it depends on Hani's proposition, but for you, ladies and gentlemen, we will do anything to make you happy, inshallah.
We know that the dosage of some drugs, say warfarin or doxorubicin, is associated with an individual's genotype. Is your company have any directions working towards so-called personalized medicine?
I'm sorry, can you just repeat the question a little bit slower?
We know that some drugs, the dosage is associated with an individual genotype. So some individuals should take lower dosage, some should take higher dosage, right? And then say some anti-cancer drug and warfarin, the anticoagulation drug. Is your company having any direction to develop, say, to work with any genetic test company to better the treatment outcome? Thank you.
Well, thank you very much. And we have clearly made up our mind long time ago that we are a company that operates in retail pharmacy. If you look at our vision, we are clearly, explicitly saying we are a pharmacy-led retailer. Yeah? We are not interested, and we are not going to be in any soon interested in getting a vertical integration into manufacturing or research of drug development. But what we will do, and the value we will add to our guests, and the beats we will add to our guests, is to make the products, which is called specialty products, specialty drugs, available for them wherever they are. When we talk about hepatitis C and oncologies and other sophisticated medications, we just started last year making them available for people around Saudi Arabia. So this is the contribution which we will do, not probably in research and development, but in reach.
We will have 2 more questions, please.
Please do.
Having mentioned Boots, Walgreens, CVS, and things like that, over the Middle East, we're mainly dealing with drugs in their trade names. Are you willing at any point to change this perspective in the Middle East in general? We're using drugs in their generic names and with the required amount of doses and tablets, let's say, that are prescribed, not just by their trade names? Thank you.
Yeah. Well, I think this market has been developed based on brands. And this is good and bad. And this is primarily influenced by the pharmaceuticals. A couple of days ago, Trump was saying pharmaceuticals got away with murder. I think they have influenced many things in the life of health and wellness. In this market and in any other market, when economical situations get tougher, people start going for alternatives. And one of the most obvious ones is to move from brands to generics. The first stage here in Saudi Arabia, people started to move to branded generics, which is something in between. And eventually, I think we will get to a point where we start to dispense dosage generics, which is the exact model which operates today in the US and other many countries. But it will take a while because this is a change of perception and habits among people. So it will come, and we are already gearing up towards that. Thank you for the question.
Thank you for your presentation. How do you see a Nahdi pharmacy in 10 years, 20 years? How is it different from it is today? Do you expect a larger retail store, something similar to CVS maybe? Do you see a Nahdi products being sold there, or just Nahdi branded products maybe?
Well, I think there are many things that are influencing the future and changing and impacting it. We have just finished our 2020 strategy. We've done extensive work to understand what is going to be the key change drivers. Well, digital is going to be one of the key big themes of the future. And we are very much aware of that, and we're putting a lot of effort and investments over there. The second big thing is result-oriented healthcare system, where people talk about results, not about input. So today you go to a doctor, you pay for what they prescribe to you and all the tests and imageries they do for you. Tomorrow you will pay for results, not for the input. I think those changes will force the market to become a fully integrated healthcare system where one person is managed through one record and one system. Not like what is happening today, which is too fragmented and people shop around and really. The other big thing which we will see in the future is the healthcare awareness among normal people is raising because of the easy access to knowledge and information. And I think we believe that through programs like this, we will play a major role over there. With regard to private label, we definitely have a brilliant platform to develop our private label. We have launched so far many new private labels. If you visit any of our pharmacies within the coming 2-3 months, you will see many products that are available in categories that are not so high risk like medications and medicines, but in everyday essential categories. Thank you very much for the question.
On behalf of King Abdullah University of Science and Technology, we would like to thank you, Engineer Yasser Joharji, for participating in our program today, and we hope to see you, inshallah, again in the near future.
Inshallah. Thank you very much. Thank you.